I'm Mike from the London Eye Centre Education Department. Hello, and thank you for taking time to learn more about laser vision correction and about the latest technology and procedures that London Eye Centre has to offer. We've broken down the seminar into several short segments, so it's easy for you to watch, re-watch, and digest on your own time. In this first segment, I would like to introduce you to London Eye Centre, British Columbia's original vision correction facility, and a leader in this specialty for 30 years. London Eye Centre is special. It was the first clinic ever accredited by the College of Surgeons of BC to perform eye surgery outside of the traditional hospital setting. Through regular reviews and inspections, we have remained in good standing with the college ever since and take pride in exceeding their high standards required for certification. Our flagship location is in New Westminster, in the center of the Lower Mainland. The facility is conveniently accessible to all communities in Greater Vancouver, with plenty of parking and flexible office hours. We also have a terrific location in North Vancouver. It is the only laser clinic serving the North Shore and is also the facility of choice for patients along the Sea to Sky Corridor, Sunshine Coast, Vancouver Island, and many from downtown as well. London Eye Centre was founded by Dr. Don Johnson, one of the true worldwide pioneers of vision correction surgery. Dr. Johnson trained and mentored hundreds of surgeons and was considered one of the key innovators in the early years of this technology. Dr. Johnson passed in an auto accident several years ago, but his legacy has remained strong to this day.
London Eye Centre was founded by Dr. Don Johnson many years ago and was the first accredited non-hospital surgical facility in the province of British Columbia. And at that time, Dr. Johnson performed cataract surgery. Subsequently, he went on to perform, was an innovator in radial keratotomy, and one of the first surgeons then to perform laser refractive surgery at the time that became available in Canada. And the surgeons that currently perform the procedure are highly experienced refractive surgeons who have been practicing ophthalmology as both cataract and refractive surgeons and or corneal surgeons for many years and have thousands of cases combined in experience.
Over the years, London Eye Centre has been a clinical investigation site for many new procedures and devices and has always been at the forefront of emerging technologies. Before the US FDA approved laser procedures in 1996, many American eye surgeons would fly their patients to London Eye Centre to have our surgeons perform the procedure. We have treated patients from over 30 different countries and nearly all 50 US states. Many of the most accomplished US-based laser surgeons began their training at our New West office. In fact, for many years, Vancouver was known as the Mecca for laser vision correction. Despite our international reputation, London Eye Centre is not a national chain. We are a BC-based company using only top local surgeons who are dedicated to our patients and the community long-term. Back in the 80s, before laser was available, vision correction was done at London Eye Centre with a treatment called RK, or radial keratotomy. RK corrected distance vision by making incisions in the cornea with a special diamond blade. This procedure was effective, but was supplanted shortly after we performed our first laser procedures in 1990. It was quickly obvious that the safety, predictability of results, and increased range of prescriptions the laser could treat was far exceeding what the original RK surgery could achieve. London Eye Centre has been performing laser correction ever since, and we are proud to now be serving our second generation of patients. Many of our patients today tell us their parents did the procedure with us years ago, and now it's their turn. In future segments of this seminar, you will hear from our surgeons and other members of our medical team, and many patients will share their experiences as well.
I can't explain how simple it felt when all was said and done. Like I said, I walked out of here going, I'm going to see better, and that's the experience? That's all I had to go through? That's exactly what I felt.
The best thing about my vision is the fact that I can see whatever I want to see whenever I want to see it. I don't need glasses for reading, for TV, for driving. I wake up in the morning and life is clear. It's wonderful.
Hi, I'm Al from the London Eye Centre medical team. There are 4 focusing problems that may make somebody need to wear corrective lenses or to consider laser eye surgery. The most common reason is myopia, or nearsightedness. This means you can see up close without corrective lenses, but things in the distance are out of focus.
Myopia is short-sightedness, and basically what happens is that the length of the eye is too long for the curvature of the front of the eye, and so the light comes into focus in front of the retina. If you're closer, then things get better. So in short-sightedness, the closer something is, the more clear it is. The further away it is, the more fuzzy it gets. So this is typically what we see in sort of young healthy people. They're a bit short-sighted. They squint to see better for the distance, but they can read fine without glasses.
The opposite of myopia is hyperopia, or farsightedness. While almost all of us are born farsighted, most of us grow out of it, never even knowing we had it.
Individuals who are hyperopic often have very good vision in their younger years, but as they get older, the first thing they begin to have difficulty with is reading, and then later distance. And then the same process would apply. They need to have a pair of spectacles not only to focus distance, but also to focus it near.
This is different than presbyopia, that is simply the eye's loss of adjustable focus.
Presbyopia very nicely means old eyes, and presbyopia is completely different because it's a lens problem. And so from the day you're born, the lens of the eye keeps putting down layers like an onion, gets bigger and stiffer. And typically in your 40s, that lens gets stiff enough that you can't bend it to focus. So now it's perfectly clear for a distance, but the closer something becomes, the more out of focus it becomes. And that's why people get reading glasses.
The last focusing problem we will discuss is astigmatism. This means the eye has more than one focus point.
Astigmatism basically means that the front of the eye, the cornea or the lens, instead of being perfectly round like a soccer ball, is egg-shaped, it's elliptical. And so what it does is it brings light into focus differently based on whether it's vertical or horizontal. And so it basically gives you blur at all distances. And you can have astigmatism in association with short-sightedness, myopia, or in association with hyperopia. At London Eye Centre, we have the laser technology to take care of all of those problems, either in combination or separately, depending on what you need done.
There is also an option to correct presbyopia by leaving one eye slightly nearsighted while the other eye is set for perfect distance vision. This is called monovision or blended vision, and it's a good option for patients over 40, especially those who do a lot of computer work or office work. We'll discuss it and show you what it looks like when you come in for your consultation, especially if you're in the right age group.
After your research is done, the next major step in your laser correction journey is to attend a free consultation at London Eye Centre. When you come for consultation, the goal for you and us is to determine if you are a good candidate for the procedure. While most patients are excellent candidates, we do have to turn patients away for various reasons, including, but not limited to, a prescription that is outside the advisable range, pathology of the eye, certain health problems, or unrealistic expectations. In addition to lengthy discussion and a regular eye examination, there are some special eye tests performed at consultation. They are painless, easy tests, but provide critical additional information over and above the standard tests.
The pentacam is unlike the older forms of corneal mapping, which used a little ring that measured only the central 5 degrees or so of the corneal curvature. The pentacam measures across the entire curvature of the cornea, providing mapping measurements, which means the curvature measurements across the entire width of the cornea and 360 degrees, as well as thickness measurements throughout the entire surface of the cornea. So that when the laser procedure is planned, we know in exact detail the response that will occur from the cornea, and whether it is safe to in fact perform the procedures in cases, say, of very thin corneas.
Another test you likely would not have had done in the past is the wave scan.
The wavefront measurements that we do measure what are called higher order aberrations. The actual refractive error, whether it be myopia or hyperopia, is considered a low order aberration. However, for extreme clarity in the eye, these higher order aberrations, such as spherical aberration and other conditions we call coma and trefoil, are conditions which can actually affect the ability of an individual to not only get 20/20, but to get a very sharp level of vision. And the wavefront measurements will measure these errors, and the laser can be set doing a procedure we call a custom wavefront guided procedure to correct these higher order aberrations and provide a very sharp level of vision.
We believe in giving you the best treatment possible and will perform a custom treatment on any patient we believe will benefit from it. Unlike many laser facilities, this is done when needed at no extra charge to the patient. Once all the tests are done and we have had a chance to chat about your motivation for having laser correction, we are able to suggest which, if any, treatment is best for you. We know this is a big decision in your life and want to make sure you will be happy with the result. Some patients are better suited for PRK, some better suited for intralaser SBK, while many can choose their preference. At Consultation, we will also discuss the risks and side effects of these procedures with you. We are fortunate to have options in the methods of laser correction that are available. The excimer laser does the same correction with all techniques. It's the preparation of the procedure that differs. The outer layer of the cornea is the epithelium, much like the outer layer of our skin. This layer regenerates quickly, so reshaping it is of no value. So the options are either to remove the epithelium or lift it. Let's look at these one at a time.
For many years at London Eye Centre, we have done a surface procedure called photorefractive keratectomy, or PRK. We use no cutting devices or abrasive contact with the surface. But in the case of PRK, we remove the surface layer of the cornea. We call that the epithelium. It's kind of like the skin of the cornea. We remove that area in the center, and then the laser will ablate the area beneath that.
A clear contact lens is placed on the eye to help keep it comfortable while the epithelial cells regenerate. This regrowth can take 4 to 5 days. About half the people who undergo PRK may experience enough discomfort to require pain management in the form of drops or oral medications, while virtually all patients will be light sensitive during initial recovery.
In the case of PRK, recovery of the is a little bit longer than it is with intralaser, insofar as the epithelial layer must regrow. That takes 3 to 5 days. Once that's occurred, the vision is usually quite good, but may take another week, 10 days, 2 to 3 weeks, depending on the degree of correction, to get to normal levels. However, most individuals following the complete healing of the epithelium are quite functional and are able to return to work.
London Eye Centre is considered to be one of the worldwide specialists in the PRK technique and has likely performed more PRK than any other single laser facility in Canada.
We also do a procedure called intralaser sub-Bowman's keratomalusis. We call it intralaser SBK. Now in this case, this is a form of bladeless LASIK. For many years required a blade keratome to make to slice a flap of cornea. In this case, the intralaser device, using a laser called a femtosecond laser, will actually create a flap with no cutting, but merely ablating tissue beneath the surface of the cornea in a thin, precise layer, which can then be reflected back and allow the same type of procedure as LASIK to be performed.
There are some procedural risks that are exclusive to LASIK, including an incomplete flap or a buttonhole caused by the blade leaving a hole in the middle of the flap. Also, many patients are not candidates for conventional LASIK due to the thicker flap the blade cuts. For these reasons and other concerns, London Eye Centre does not perform blade LASIK on our patients.
The advantages of intralaser are that it's a procedure which allows quicker recovery. The patient will experience only mild to moderate discomfort the day of surgery. By the following day, most individuals have no discomfort whatsoever, and most individuals will see very well the next day, some extremely well. Others may take 2 or 3 days to recover. But return to function, work, etc. is very, very quick. Often patients going within 2 to 3 days back at their normal function.
The thinner flap allows many patients who are not candidates for blade LASIK to safely undergo a flap procedure. A laser-made flap also allows the surgeon to tailor the shape and size of the flap to the unique anatomy of every patient's eye.
The excimer laser basically uses a gas to create an ultraviolet laser beam. The ultraviolet laser beam is very tightly controlled, both in terms of the energy and the location to which it's delivered. And what it does is it's like the Star Trek phaser. It vaporizes things. It actually takes solid material and it turns it into a gas. So by actually pointing the laser where we want, we can remove tissue to reshape the front surface of the eye, the cornea. At London Eye Centre, we use the Star VisX S4 IR laser. God, it's a lot of letters to toss in there, but that's the latest version of the excimer laser made by the company VisX. And that is our laser of choice for a couple of reasons. The first reason is it minimizes how much tissue is removed. So there's only what you're born with in terms of thick corneal tissue is what you have to use for your entire life. And so the less tissue we can remove to do a correction, the more you have there to structurally keep the cornea stable, and the more you have there so that if we need to retreat later on, we can do that safely. So that's the biggest advantage we find with it. The second is that, like all of the latest generation lasers, it tracks the movement of your eye. So it allows us to deliver onto the surface of the eye exactly the shape that we want, even if you move your eyes around a little bit, even if there's some little changes that we can't plan for. So it allows you to carve onto the surface of the front of the eye exactly what you want in terms of what you've planned. With a nearsighted eye, what you want to do is you want to make it concave. You want to actually flatten out the center of the cornea. And so what the laser does is it removes more tissue in the center and then less as you get out to cause a bowl shape in the center. For a far-sighted person, you want to do the opposite of a myopic person, which is you want to steepen the center of the cornea. And we do that by removing a donut of tissue around the center. So in a hyperopic correction, you don't touch the center, but you remove a little groove or a gutter around the center, which effectively steepens the center part of the cornea. For astigmatism, you have to actually remove it's basically like a semicircle of tissue. So it actually removes a band of tissue deeper in the center, thinner at the outside, to get rid of that difference in shape between the two axes of the cornea.
On the day of your treatment, you will be at the clinic for an hour to an hour and a half, but you'll be in the laser room for just around 10 minutes. When you come in, we'll get you to finish the necessary paperwork. Then you'll meet with the ophthalmologist who will be doing the treatment for you. The doctor will review your initial consultation you have already had done and double check all the important elements and measurements. Then you'll be told what to expect during the procedure, step by step, and you can ask any last-minute questions you may have.
We then get you into our preoperative area where we put a hat on and we put some drops in, some freezing and some antibiotic. You then would lay there for about 5 to 10 minutes while we get the laser programmed for you. You then go into the operating room where we lay you down. We do the laser procedure on one or both eyes, depending on what needs to be done. With an intralace procedure, we would make both flaps before we actually reshape the eye. So we actually start off in the operating room with you. We put a suction ring on the surface of the eye. We engage that. We then swing you under the laser that makes the flap. We dock the laser with that suction ring and make the flap. We then take all of that stuff off the surface of the eye. It is quite fuzzy after the flap is made. We cover that eye. We make the flap on the second eye. And then we swing you under the second laser, the excimer laser, to reshape your eye.
They will be looking up into the laser. They will see a small blinking orange light, which is their fixation light. I then explain to them that the laser will track their eye during treatment, and that we'll be putting a small retractor between their lids to keep them apart.
With PRK, to actually get to the stroma, the actual substance of the eye, we have to remove the skin surface. So we put a little ring on the surface of the eyes, and we put some alcohol in there. The alcohol sits there for 30 seconds, it loosens the skin surface, and then we can just wipe the epithelium off.
The laser is used to reshape the cornea. There is no pain involved during the procedure. The only unpleasant part is the possibility of you smelling something similar to burnt hair. But rest assured that nothing is burning. The excimer laser is a cold laser. At the conclusion of the laser treatment, the surgeon may choose to dab a small amount of another type of solution on the eye for several seconds to reduce or eliminate the potential of the eye overhealing. That would require more laser treatment in the future. A clear bandage contact lens is then placed on the eye, and the whole process is repeated for the other eye, assuming you are having both eyes done. The contact lens is left in place until your epithelium has regenerated, at which time we will take the lenses out for you.
We then get you back outside. In the postoperative area, you would get your postoperative instructions in terms of drops and activities. If you have PRK, then you're ready to go at that point. With intralays, we like to check the appearance of those flaps that we make afterwards twice. So we see you once, the surgeon would see you once right away, and then in about 20 to 30 minutes after your procedure to make sure it looks good, and then you would be ready to go. The bigger the prescription error, the more of a wow factor there is right away. So if you're about a 1 diopter myope, things aren't that blurry without your glasses. It's always not perfect right after the surgery, and so you may not notice. The 5 or 6 diopter corrections that we do, or the big astigmatism corrections, they get up off the table, and the ones that are funny are the ones that cry. And are you okay? And they're, I can see. And so there is definitely a wow factor, but the wow factor is really comparing what you could see before without glasses to what you could see afterwards. We don't expect any of our patients to have perfect vision walking out of the building. It's going to be a bit murky, and it will get better over a few days to a week.
If somebody had told me before the surgery that the most pain I would feel would be basically shut your eye and just apply soft pressure to your eye until you feel a tiny little bit of resistance, that was it.
The doctor informed me every step of the way, what he was doing and what he was putting in my eyes, so I wasn't caught off guard in any way. So that was comforting. It was a really short procedure. After that, I was able to lay down for a couple minutes, let my eyes rest. They put some more drops in, and then the nurse came over and talked to me about my follow-up procedure and what kinds of drops I'd have to use.
The service, the follow-up service, and the procedure itself here at London Eye Center was easy enough, even though I'm a big, strong football player. The thought of this terrified me, and the whole process was so seamless, so comfortable. I can't recommend it high enough.
Well, I'm here for my first day post-op and just talked to the doctor. He said everything's great, so I'm ready to go.
There are only 5 or 6 post-operative visits the average patient will need to have. For PRK, the initial visits are at 1 or 2 days post-op, then 3 or 4 days, and possibly at 5 days after surgery. The timing of these visits is based on the day of the week you have surgery on and how quickly your eyes are healing. With intralays, you will be seen the day after and 1 week after surgery. From this point on, the visits are the same for either procedure. 6 weeks, 4 months, and 10 months after surgery, approximately. A very small percentage of people will need to have another treatment done because the desired result was not achieved.
The rate of retreatment depends a little bit on how complicated your prescription is. The smaller your prescription, the lower the rate of retreatment. And so 1% is what we kind of quote for people who have small prescriptions. If you're a -12, which is about the limit of what we can treat, your retreatment rate is probably about 8 to 10%. So it does vary a bit based on your prescription, and we do tend to customize our discussion about what your risk of retreatment is once we examine your eyes. People worry that there's a financial risk to retreatment, and the answer is no. We will certainly do your retreatments at no cost. And even 20 years from now, if your eyes change and you need to have it retreated, then we would cover the cost of retreatment.
PRK retreatments are done a minimum of 6 months from the surgery date. Intralaser retreatments can be done as early as 1 month post-op. After the 10-month post-op visit, you are asked to return to your regular optometrist or ophthalmologist for routine eye exams at whatever intervals that doctor recommends for you.
I'm a professional football player, so my job really relies on seeing what I'm doing for real. And we spend a lot of day watching film, game tape, and you know, the room is big and sometimes I'm far away, and it got to the point where I was spending most of my day squinting.
And I was training to be a lifeguard, and you're not allowed to wear contacts or glasses when you're swimming, so it's made it so much easier for that, and just traveling around and just not having to worry about having contacts. Just everything though, everything's easier.
Probably when I was about 12 years old, me and my girlfriend were talking about if we had one wish, what would we wish? And I said I'd like to see. That was what I really wanted, was to be able to see without glasses.
Not being able to see is just one of those things you think, okay, yeah, well, I'm not getting any younger. But I feel like I put that a little bit on hold, which is really a breath of fresh air.
I have dry eyes, and so wearing contact lenses meant I'd have to either put drops in by the end of the day or rinse my lenses out, which was, if you're going out, it's a little hard to do. You'd have to carry the stuff with you in your case and your solution. I'm also quite blind, so...
My brother had gone to London Eye Center. An ex-teammate, Rob Murphy, had used this. I remember I took him to his appointment. So I called around and asked, and you know, just the recommendations and referrals were glowing from friends and family members that had used this service. Couldn't speak highly enough of London Eye Center. And the more I asked around, the more London Eye Center kept being the name that popped up.
I had one of my best friends came to London Eye Center 4 years ago and got her laser eye surgery, and she said it was the best thing she ever did. Many of her friends had it as well, and one of my really good coworkers too, she had it a year and a half ago, and they all told me you have to go to London Eye Center. It's all laser, no knife, and yeah. I looked into it. I know that they've been doing it for over 20 years, so I trusted the name and I came, and couldn't be happier.
My husband and I agreed that we wanted to go with something that was a sure thing. We didn't want to go with the cheapy deluxe version of the laser eye surgery, because who wants to take that risk with your eyes?
When you're dealing with something as important as your eyes, you want to feel comfortable the minute you walk in the door, and I was, from the reception and receptionist to the tests. They explained clearly what was going on. It didn't take long, and I'm not talking about the surgery because we know it doesn't take long, but the process leading up to the surgery was quick, it was clean, it was concise, it was explained to me what was going on and why it would work.
The best thing about the all-laser approach at London Eye Center would probably be the information I received from the staff. They were very warm, really welcoming, answered all my questions. They gave really clear direction as to what's going to happen, how quick my eyes would heal. I was very comfortable when I walked in and I sat in the chair.
Come in, get your checkup, find out, make sure you're a candidate, and hear what they can do for you, because it's fantastic.
It's a lifetime guarantee, which means a lot to me. Actually, one of my coworkers had LASIK 8 years ago, and she was back in glasses within 4 years, and she can't afford to get her eyes done again. So I don't have to worry about that. That is definitely one of the reasons I chose London Eye Center, because I know it's lifetime guarantee.
London Eye Center has really been there for me, and they've been great to me. They have an absolutely excellent warranty, which through my experience I had forgotten about the warranty, but they really came through even 10 years after I had the initial procedure done.
The idea of using the all laser was very mentally comforting too, because there was nothing having to touch my eye, and I'm just one of those people, I think, that, well, I think a lot of people are queasy thinking about a blade going to their eye, so it made sense to me.
I can't explain how simple it felt when all was said and done. Like I say, I walked out of here going, I'm going to see better, and that's the experience. That's all I had to go through. That's exactly what I felt.
Even on the way home, in the car, sitting next to my husband, saw a street sign for the first time without glasses or contacts, and was really, really impressed.
It's been 4 months since I've had my all laser vision correction, and it's been absolutely amazing. I can see everything, 20/20 vision, and definitely best thing I ever did.
I have clear vision. I mean, that's not something that everyone can say they have, and I don't have to spend money on glasses, on contacts, or anything related. I can now spend my money on really fancy sunglasses, which is really fun.
It's wonderful to actually know who's yelling at you from the second fairway over, and to be able to see the flag and to actually track your ball, even if it does go into the trees. It's nice to be able to see it.
I can see clearly the minute I wake up. I can go to the beach, I can jump in the ocean, I can jump in the swimming pool, I can see my family and friends far away along the beach. I don't feel lost in situations or worried if I lose a contact. Basically, my vision is there 24/7.
The service, the follow-up service, and the procedure itself here at London Eye Center was easy enough, even though I'm a big, strong football player. The thought of this terrified me, and the whole process was so seamless, so comfortable. I can't recommend it.